What questions or problems are you working to solve?
One thing that I've spent a lot of time thinking about through my career is how we can help people take medications better. I was initially trained as a pharmacist, and now I am a full-time researcher. And something that's really motivated me is how can we help patients take medications, particularly chronic medications that are evidence-based, we know they work in a vacuum in clinical trials, we know that there's really good effectiveness around it. But we know that people generally struggle with taking medications regularly, and it's something that physicians and clinicians really struggle with helping people do, because it's something that people are doing on a day-to-day basis on their own. We have a lot of interest in trying to improve this because this is a problem that both internationally and domestically, we know that most patients really are able to take medications faithfully about 50% of the time. There's a lot of reasons for this. We know we've been understanding more and more about the contribution of costs to how patients take medications regularly, whether people have issues of forgetfulness, cognitive issues are related, whether people believe that medications are important. Side effects are obviously a big issue. But we're really kind of increasingly understanding is that a lot of people have multiple issues. These issues, cause people different issues at different periods of time. The way in which people take medications is something that is also quite cyclical. So to try to really understand the problem and then develop interventions for it has been something that I've been spending the last decade or so of my career really thinking about. And so to understand the problem, we've been using kind of different methodologic approaches to understand patterns of how people really take medication. So for example, we can use these sorts of data-driven models that apply longitudinal patterns to how understanding groups of people and their patterns of how they take medications over time. And so if we just took an average, we would find that like 50% of people take their medications regularly. But when you actually break out the groups and apply these different modeling approaches, there are people who are really quite faithful to taking their medications. There are people who basically are only able to take them once and then never are able to take them again. And then there are people who kind of go in and out of taking them. And so, sometimes something clinically may happen to them and then they are able to take their medication again, or they've been taking it for a while, but their co-pays went up. And so understanding the different groups and who falls into these different buckets and what the contributors are to why they fall into these different buckets and change over time is something that's really important. Because until we understand that, it's going to be difficult to develop interventions to do that. But kind of the other lever of thinking of things that I've been thinking about over the last couple of years and what I'm still really quite passionate about is, well, okay, we have decades of understanding that these things are problems, but how do we actually fix them? And, we've done a lot of understanding of what really works. And based on some research that we've done, we found that most people have multiple barriers. People who are not adherent to medications, about 30 to 40% of them actually have multiple contributors to why they're having issues. It's not always just cost, it's not only just forgetfulness, it's kind of understanding who these people are. And so because of that, we're finding more and more that we don't have just a magic silver bullet that tends to work for everybody. And people typically need more than one thing. But some of the most successful things that our group has studied and others as well have been that certainly making medications for free definitely helps a certain percentage of people, but some people were adherent anyway, even before that. And some people that still is insufficient. Helping people, something that we've spent a lot of time thinking about is using technology to help with reminders, helping people understand when their medications are important, really engaging in two-way interactions with patients. Those seem to work. Clinical pharmacists also seem to have a nice layer on top of these things. But in general, multi-component interventions are generally what seems to work. But it's figuring out for whom, how often, like this is kind of what will really move the needle, is really kind of understanding who needs what intervention and when, and maybe we can use different types of prediction models or different types of technology ultimately to be able to triage interventions better for patients who have different patterns of medication taking.
Why have you chosen to pursue this question or problem?
So I've really focused in on medication adherence or patient medication taking as a key problem of interest for me for several reasons. Number one is it's been a clinical area that I've seen as a clinician when I've been practicing, that this is something that patients struggle with. I've worked in a pharmacy, I've worked at a hospital, I've worked in many different ways of talking to different patients. I've gone to their homes and straightened their medications as a pharmacy student. And what I found really challenging is that a lot of people had issues, and then it was just really outside of the ability of the health system and clinicians to one-off individually be able to help these people. And so I was really interested in what can we do from a population health perspective, kind of a more top-down sort of perspective to make this easier for people. And so my interest has really been driven by seeing these problems in patients, supporting that in what we've been learning in the literature, combined with what we've been doing, really diving into the different problems and trying to understand what issues people are having, understand different interventions and for whom they work and for whom they don't. And really just seeing that we have been able to move the needle some, but we want to also make sure that we're not leaving some patients behind if for some reason certain interventions work for some but not others. So for example, the study I referred to earlier that our group did several years ago, where we studied what the impact of reducing co-payments completely was on patients. And in this context, it was after a heart attack. We found that in that context, actually reducing medications and making them for free actually helped reduce racial and ethnic disparities in patients' medication taking, and then ultimately clinical outcomes as well. This was a great find because often when we improve things on the average, we tend to leave groups behind. So it's not even just understanding whether things work on average, it's making sure that groups aren't left behind because we know that that happens, and that's of critical importance to understand. So I continue to be really interested in this area because it's something that doesn't just affect patients domestically, it affects them internationally. And we've seen some success and we've been able to move the needle. But it's really about how can we take what we've been learning and try to implement these interventions better and more specifically for the patients who need them. And there's a lot of kind of really exciting work happening in that area.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
So as an individual, there's a lot more, research and understanding of the problems that could be done. There certainly needs to be a lot more research into different interventions that work for people, understanding for whom, when, how often, these sorts of things need to be delivered. Certainly needs to be more research into that. And particularly with emerging technology, like the role of technology is going to be really critical. We've been thinking about and using different machine learning based ways of tailoring the communication that people receive through text messages on a day-to-day basis so that it's actually responding to what patients typically need on that day and giving them the information that they need. And that seems to be quite promising actually. And so as an individual, there's research that could be done. We certainly need individuals to focus more on how we can implement interventions better. And as society, I think just really understanding the scope of the problem and understanding that just because medications are available doesn't mean that everyone can take them the way that they're intended. And that, studying efficacy in a vacuum is great, but we really need to focus more on the downstream effects of the medication choices and availability that are out there. And so a lot of the, population level interest in reducing medication costs is really important and really great, but we don't want to also lose sight of other ways and other things that are causing people issues like side effects, dosing regimens, a whole bunch of other things that actually can affect patients' daily medication taking as well. So I think there's really a lot that could be done. From an individual perspective, from thinking about research, from thinking about implementation, from thinking about policies, but also from a population health standpoint to understand that, there may be individuals who you're working with that you may need to ask more specifically about their medication taking behavior. Maybe it's more than just say, things are going well with your medications, right? It's learning a little bit more about how to ask questions that people would really give you the answers as opposed to just kind of giving you more generic answers and really being able to elucidate the problems, because that's really the first step.